And everyone, thank you so much for being here. I just want to let you know that this training is being delivered in partnership with the Court Improvement Program of Colorado and the Family First implementation team and the various partners involved in that. This is going to be one of many trainings on this topic, and we will be offering this to other stakeholders in the future. I am Megan Kearsley. I represent the Court Improvement Program. Thank you for being here.
Thanks so much, Megan. And I'm Ashley Chase. I think you all know me, obviously, but I'm a staff attorney and the legislative liaison here at the Office of the Child's Representative. I also serve as the co-chair for our Colorado Family First implementation team, which is the role I'm really coming today to train for. So this is much more my co-chair hat than my OCR hat. But you are our first audience for the training. As Megan said, this is going to be a series. We're going to do this for all of the different partners. So county attorneys, judicial officers will be the next two. And then eventually county staff and respondent parent council. They chose to delay it for a little while. So it'll be ongoing. That means you guys get to help teach me where all of my pitfalls are in this presentation since it's the first time. So I appreciate you doing that. And we will get through it as best we can. Wanted to preface this like I do every Families First training, which is to remind you that I still don't have all the answers, as frustrating as that may be. We have more answers than we did last time I talked to you about anything related to Families First. We do not have all the answers. I feel pretty confident that if there are answers out there, I know most of them. We will soon have a colleague of mine, Angelina Callis, join us. She is the Families First program manager for the State Department of Human Services. So if for some reason I can't answer a question, she likely can. But again, there are some questions that we don't have answers for yet. So I can often tell you who's working on it, but I just like to preface that because I don't want people to be frustrated at the fact that we don't necessarily have all the answers still. Families First is continuing to evolve. I think as most people know from emails I've sent and the digest updates that obviously Colorado did not opt into Families First on the timeframe we originally thought we would. One of the main delays to that was the IMD issue. I sent you guys all a pretty thorough email about what that looks like in Colorado, but that does impact our ability to have QRTPs in order to opt in. So that's why opting in was pushed out. We don't have an opt-in date again at this time, but I can tell you from the implementation team side, the work is continuing. We are getting closer and closer and closer and really dialing things in. So even though we don't have a date for implementation, even though we don't have all the answers on the IMD and QRTP issue, we really felt like the GALs have been asking for trainings like this, and we wanted to go ahead and provide it. It probably won't be the last training we do on this, but I think what is key is that our guardian ad litems and other stakeholders that'll be in the court will be prepared when we are ready for what these hearings look like, what your role is and what it looks like so that it can hopefully be seamless and effective as possible. I do think Angelina is on with us now. So Angelina, I appreciate you being here. You'll be my like phone a friend person. So thank you so much for doing that. Also, just kind of how this is set up today is I sort of have one slide per topic. So I'll kind of go through the slide of my talking points and I'll pause at the end of each slide for questions so that we can kind of group the questions with the particular topic that we are on at the time, if that works for folks. So with that being said, I'm going to dive in and let me make sure I have everything working here. Great. So first, it's been a little while since we've talked about Families First. I know that I've done several trainings for you guys on this, both in our in-person trainings. Remember when we used to do that? Those were the good days. And on our webinars and things like that. So because it's been a while, I just wanted to quickly review the basics just of the QRTP. I'm not going to go back over all the Families First information. But if you'll remember with Families First, that's changing the way that 4E supports placements. It's one of the things it's doing. It also supports the prevention services, obviously. But with Families First, it will support keeping kids at home with wraparound and intensive services. It's going to support kinship placements. It will support family foster homes, and it will support QRTPs, which stands for Qualified Residential Treatment Program. That means it does not support what we now know as group homes or group centers. It won't support what we have as RCCF level of care right now. There are some limited exceptions we've talked about before. There's those carve out groups for like our pregnant and parenting teens and those that are victims of human trafficking. But outside of those limited kind of exceptions, this idea of congregate care really isn't supported unless it's going to be in this QRTP setting. So there are requirements to become a QRTP. The big one was that it was licensed and accredited. There are only a few accrediting agencies in the nation, so that is something that needed to happen probably early on, or that some people are looking to get done now. It does have to be trauma informed, and so there are rules that have been promulgated in Colorado to talk about what that looks like and how they're going to track it and make sure it's happening. That's going to be a really great part of this QRTP process. It requires this independent assessment done by an independent assessor. That's going to really come into play a lot in court and what we rely on when we look at this. So we'll go into that today. It really involves family and siblings in the treatment in a very intentional way, which I think will be great for the youth and families. There is this court approval process, which is obviously why we're here today. The bench card is really based around that process and what it looks like. And then QRTP does require this aftercare support. So there's that 6 months of aftercare services that comes with it. So that's just kind of the basics. We'll get into it as we go along. And like I said, we can answer questions if people, have specific questions about QRTP in general outside of those basics. So this is the bench card. This is what it looks like. Just for a little bit of background, this was created by, again, our Families First implementation team has several work groups that work underneath it. We've talked about this before in other presentations. One of those work groups is the QRTP work group. Shocking. We have very creative names in our implementation team. And that QRTP group had a smaller like legal subgroup that kind of created the bones of the bench card. And we made sure we had county, state, parent council, child council, judicial officers, county attorneys. Like we kind of had stakeholders from all of the areas involved in court to put this together. And then that small group vetted it through a variety of groups. So it changed, it had additions, it had changes. It went through the implementation team, it went through the QRTP group. I think the task force maybe looked at it. So there were quite a few different lenses that it was viewed through. And this is what it came down to. Tried to keep it to the 2 pages because that's what seems to be helpful when you're thinking about a bench card. Because again, ideally, this will be a tool that is actually used from the bench by judicial officers. We're using it as the basis of training for all the other partners in court because it seemed like a really good way to all have the same information, consistent understanding, really consistent language, which we hope will make this process very seamless in court and work well for everybody. I will tell you, in this version that is a picture on my screen right now, at the very top of this well, let me go over here. At the very top of this section here, I don't know if you could see my mouse moving. There's a link, there's a statutory site here that has a typo. It shouldn't be this little G, it should be an H. The one that Michelle sent you this morning actually has rectified that, but just in case you notice on my presentation, that little change, I just want to flag it for you that has been fixed, and the version you were sent this morning shows that. So now the way this training set up is we're just going to take this document and we're actually going to walk through it section by section. That's how we're going to go through it. And hopefully by the end, you'll have a good understanding of where we're at. So that being said, my first section I'm going to start with is just the time frame. So if you look at the front of the bench card, this box down here is where the time frames are kind of laid out in an easy to see way. It's important to note that when we talk about these dates and these timelines, it starts from the date of placement itself. So that's the triggering date. There was a lot of conversation around that. It's interesting, in creating the bench card, there was a lot of work with the statutory review group because they were working on statute that needed to be reflected in this bench card. So they, again, vetted a lot of this stuff. There's a lot of language in here that ended up being compromise language and things like that. So hopefully you'll find that the bench card is really aligned with those statutory changes. Some of those I'll point out as we go along. And this idea of when it starts was a big conversation, but it does start from placement. That's something we were able to nail down. So you can have a child, youth, or juvenile placed in a QRTP or really any setting under Families First for up to 14 days. And you can pull down that 4E funding within that 14 days. After that 14 days, though, is when things get a little different. So when it comes, well, I should also say what is in statute is pretty broad. What potentially might be in rule or what are going to be best practices are going to be even tighter timeframes. So best practices are going to be that this process, this assessment process, and looking at whether a youth is appropriate for QRTP will ideally be happening prior to the placement ever happening. And if that's the case, we really hope for like shortened timeframes and things like that. Obviously, there are going to be times when a youth is placed in an emergency situation or they're placed in that QRTP for some reason right away without the process being able to happen ahead of time. And then, of course, that placement triggers all of these timelines. We really in Colorado wanted to have the timeline be 14 days, to be honest. We wanted youth to not be in QRTP if they didn't belong. But in reality, with the way the system is working and trying to roll this out initially, we had to align more with some of the federal timeframes, although we did make some little Colorado changes that I'll point out as we go. So that generally, when a youth is placed in QRTP, that placement must be reviewed and approved by the court within 60 days of placement. However, like I said, this is one of those little Colorado changes. In Colorado, if a youth is placed in the QRTP and the assessment comes back and says that's not the appropriate level of care for them, then that hearing has to happen within 30 days of the placement. So this little box that just popped up is where that's covered here in the bench card that talks about the initial hearing timing and requirement. The Families First bill that went through this last year was Senate Bill 20-162, and that bill codified this change in 19-115, and I think it's subsection 4E, if I'm not mistaken. So that kind of talks about the timing of when you have to have this hearing. If the placement is not approved, then the youth has to be moved out within 30 days. Now, we say must be moved out. Technically, obviously, you could keep a youth there as long as you wanted, but you're not going to pull down the federal funding for it. And I think best practices would say the purpose of this is to ensure that kids are not languishing in congregate care or not placed in placements that don't meet their needs. So it is really important that if the youth is assessed or the court decides they don't belong there, that we get them out of there within that 30-day time frame. If the placement is approved, however, then you have to review the case every 90 days at a minimum. And we'll go over some of those requirements later in the training. I think ideally these would happen with your hearings that are already happening in court. So it's not like it has to be its own standalone hearing. It can happen with your reviews or your permanency plan hearings or whatever's happening during that 90 days, but it needs to happen at least every 90 days. And there are these really interesting time limits. You'll see this down here. There's time limits for how long youth can be in these settings. So again, if you take yourself back to some of my prior Families First trainings, like at fall conference and things like that, we talked about some of the purposes behind this QRTP. And one of them is that these are not supposed to be long-term placements for kids. That was never the intention. It is supposed to be very, directed, therapeutic, intentional treatment for kids. And it should be short timeframes. They get in, they get stabilized, they get the treatment, and then they move out into more family-like settings where we know youth do better. So as part of the federal law, they made these timeframe limits. So there's 2 different limits that's triggered by ages. If you are a child, youth, or juvenile under 13, then you can only be in a QRTP setting for 6 months, and that's either consecutive or non-consecutive. There are protocols for exceeding that if needed, but it requires approval by the director of the State Department of Human Services. So that's obviously going to be a little onerous. So it's something that people will take seriously. There is a group working on the process by which to get that approval. I have not seen what that looks like in its final stages yet. So know that's being worked on. When we know what it is, we'll be sure to share, but we don't have that all the way nailed down yet as far as I know. If the youth is over 13 and over, then you get 12 consecutive or non-consecutive months for that continued placement. So it really depends on age, which I think is very appropriate given the needs we know of kids and things like that. So that's a big change. And I just want to point that out to people. Um, it's going to be interesting to see how that works out. I think obviously it won't backdate. So kids that have been in care for quite a long time, once we start QRTP, that count will start. But we're not going to have a youth that's been in QRTP for several months, like be at their, only have a month left when we implement that. Obviously, would not be fair. There's a lot of work being done to ensure that those youth that are currently in placements that are not going to be supported under Families First will be grandfathered in. So this shouldn't disrupt placements. It will make us make better choices as the placements move and change and kids step down or they have to move from one to another. But there will be some grandfathering clauses and things like that that we'll be sure to tell you about once they're fully spelled out. Obviously, there's also going to be discharge from QRTP. And one of the exciting things I think we've talked about before is it does require this 6 month of aftercare services. And it's a requirement. So I think that's really exciting that that's going to happen. And we'll talk a little bit more about that as we go along. So that's kind of walking through just the basic timeline. Obviously, we'll get into some of the pieces involved in this, but were there any questions, Megan, just related to some of this general time frame stuff?
Yes, we've got two questions. Ashley, the first is what happens if the court orders continued placement beyond the 6 to 12 month timeframes, but the director of CDHS does not?
What happens is the Department of Human Services cannot pull down 4E funding for that placement again. So there are, as we walk through the bench card, we'll talk about, when a court is going to deviate from some of the recommendations and what that means. But that placement would not be supported by 4E funding after that point.
Thank you. The second question is, does time spent waiting on a bed while in detention count for the 6 to 12 month max?
So detention is not a QRTP. So remember, all of these timeframes start at the time of placement. We are going to talk a little bit about juvenile justice and how this intersects because it does apply to juvenile justice and there are some nuances that can be a little bit tricky. So if you're sitting in detention, you're obviously not in the placement, so the time frame would not start at that point. And I mean, you raise a good point. Obviously, some of our juvenile justice requirements not conflict, but are a little bit at odds with some of the Families First work. And we do have a work group working on some of these issues, and we'll get into that in a later slide as well. All right, and that was 2 questions if my math is right. I have, I'm teaching kindergarten these days, so I'm pretty good at counting.
You are good. However, one more just snuck in. So if I may, I'll just ask one more.
Okay.
With some frequency, kids with JD cases, especially SO cases, also have DNN cases filed. These kids are going to be in out-of-home placement for much longer than 12 to 18 months. We don't have placements for these kids even now. How does CDHS make this decision?
Okay, so first of all, that is not about the time frame. Why? No, it is. There's a lot of different work going on about the placement continuum. I mean, because really your question is broader, right? The placement continuum itself is going to be an issue when we start Families First. Yes. There are several work groups started at the State Department of Human Services to address this right now. That's kind of kicked off by this whole IMD issue. So they're going to be working on, trying to figure out how we can come up with these small bed, high quality therapeutic facilities that'll be available for kids. There are some rules going in through the process now to introduce a new level of therapeutic foster care with different supports and different funding that I think can be used for a lot of these types of kids. There's going to be a whole lot more services offered in the community, in wraparound and things like that to try to keep these kids with kin and at home. The State Department is working on, some of our specialized populations that may need different rules and things like that. So, I don't think they have the answers yet. They're working on having a much more robust placement continuum. I don't know if anybody has seen some of the work coming out of like the Tennyson Center right now, but Ned Breslin, the CEO there, is really thinking outside the box and they're changing what they're doing and they're starting to offer some really amazing services and having some good luck with small numbers. So nothing that we can really count on yet of getting really, really difficult kids placed in more family-like settings with some pretty intensive supportive services. So there are people working on this. And there are going to be some kids that will have to get the director approval. So what the director is going to look at to approve that, that's the process that's being vetted right now. So I don't know exactly what it looks like, but there is a group of people working on it so that that option is available if it's needed. Did I answer that question? I sort of went up on a tangent, I feel like. I can never tell because I can't see anybody's faces. All right, I'm going to carry on and act like I did. And they can circle back if I didn't. And Angelina, I know you're out there, so if you want to jump in onto any of these Q&As, by all means, just interrupt me, and otherwise I'll leave you alone. Okay, so now we're going to talk more about that initial QRTP placement. So this is obviously when this youth is entering this time. So if you had somebody who was in QRTP placement for 2 months, and this is, the next case, and they're going in again, this is obviously starting it again. If you have somebody who's going from one placement to another placement, you wouldn't necessarily have the whole process, depending on the time frame and how long it's been. But in any case, let's just treat this today like we're talking about a kid going in. Their initial placement means they haven't been in QRTP before. So these are just some of the considerations that should have taken place prior to going to court. The reason we put this in here is that I think it can really help flag for the judge or for any of the attorneys or whoever's in the room, any potential issues ahead of being in court and to rectify them. Because if some of the things that are required by Families First aren't happening, then you're going to have problems in the hearing stage, or maybe you shouldn't be going forward. So the idea here is just to kind of be thinking about these proactively, so you can make sure to rectify any issues prior to getting there. So obviously, knowing the placement date, because that triggers all the timeframes, is really important. The age of the child is going to impact those timeframes. Whether they've been in QRTP before, how long that placement was is going to be important, because if you have 2 months to work with versus 6 months to work with, that's going to be something important to know as a team. I mentioned there's going to be a process being developed if we have to go over those timeframes. It isn't developed yet, but once it is, we'll be sure to share it out with everybody. You'll remember this QRTP placement requires this independent assessment, and that independent assessment has to, be by a qualified individual. We'll talk about that in a moment. It has to happen within 30 days. The court needs to see it, these kinds of things. We're going to be getting it. We, meaning the GALs, are going to be getting it. The court's going to be getting it. The agency needs to assemble this family and permanency team, because they have to be incorporated in these decisions. That's part of Families First. That's part of the change. So it's going to be important to make sure that's happening ahead of time. And this should hopefully, really, if this process is being followed, I think it might help in the court process itself with, the department feeling like they're being overruled on the record or being caught by surprise, or the judge being put in a difficult position of maybe not having all the information they need to make a good decision. If these things are happening and this independent assessment is happening and this tool is being used, we should have some really good evidence to rely on to make these decisions in a much more meaningful, intentional way, which I think is exciting. But we need to make sure that footwork was done so that we can rely on some of these results and recommendations. This part down here is really important for us as guardian ad litems, because this family and permanency team that's going to be assembled for youth that are over 14, they get to select members. And so we want to make sure that's happening for our youth. And the other part that Families First requires is that these meetings are held in a time and place convenient for the family. I know we try in some ways to accommodate families with time frames and things like that, but our accommodations only go so far. And this is a requirement of Families First. This is not optional. So I think it's really important and good for our children and families, and something that we need to be really watching out for and making sure it's happening. There's a pretty short time frame at the beginning of these cases. Some of this stuff's going to happen pretty quickly. So it's going to be interesting to see how that plays out in the process. And I think it may mean that the department has to do some meetings in some strange places to accommodate the family or at some odd times. But that's what's required. And I think that in the end, it will ensure that we have really good family engagement, which is one of the foundational cornerstones of why we're doing this. And especially in Colorado, we've had some really amazing team members that have held our feet accountable to this kind of value, and making sure that we're being really family friendly and youth friendly and keeping those voices out front. Any questions about this, just sort of initial couple of nuggets before we get into the independent assessment?
No questions just yet. We'll give it a second, see if any come in though, Ashley.
Sure thing. And if they do, you could just interrupt me, but I'll keep on keeping on. Which reminds me, now that I just said keep on keeping on, Michelle, maybe you shared this and I missed it, but I'm going to say it again just in case, because apparently I wasn't listening all the way. If we do go over our allotted hour today, which I'm going to try really hard not to, we're going to keep going and you guys should feel free to jump off. But this is being recorded to be used for our guardian ad litems that couldn't attend today and for other professionals. So we'll keep going. And if you can't, we totally understand, but I will try to get through it quickly. So obviously, when you're talking about this initial hearing, the independent assessment is going to be vital. I mean, so we've included a section in the bench card around the assessment and what is required. As I mentioned previously, or I think I may have mentioned, I'm sure I've mentioned in previous trainings, the individual assessor has to use a validated assessment tool. In Colorado, that has been selected and it is the CANS. We've talked about that before. The CANS is a validated tool created by Dr. Lyons. It's been used in many other states with pretty big success. One of the reasons that the CANS was so, I think, attractive to Colorado using it is that we'll get a lot of comparison data from other states and things like that, which I think will really help us when we're talking about outcomes and if what we're doing is working and being effective. There are counties who had been using CANS. The CANS can be adapted for a variety of situations. So there's a lot of positives, I think, about this particular tool. And that is what we are going to use in Colorado. So obviously the tool in and of itself isn't the be all end all. It has to be administered by a qualified individual. So what is a qualified individual? Well, that Senate bill I talked about, Senate Bill 2162, added a definition of qualified individual to 19-1-103. So it's in our definition section and you can read it. And this really talks about how a qualified individual, can't be us. It needs to be a trained professional or a licensed clinician. They have to be approved to serve in this role. They cannot be an interested party. So we really want to preserve that independence of this assessor. So not somebody who's beholden to the Department of Human Services, not somebody who's beholden to the placements themselves, somebody that doesn't have any sort of financial interest. So you really get that nice independent viewpoint. So this definition kind of fleshed that out this year in statute. So in Colorado, this is going to be through what they call ASOs. So I don't know, ASO is something, I don't even remember what it stands for. Maybe Angelina can remind me of what ASO stands for.
Administrative Services Organization.
Yes, thank you, Angelina. Best phone a friend ever. Oops, go back. So the ASOs will have these independent assessors that work for them, and there's going to be all kinds of, the oversight is going to happen through OBH. So that's the Office of Behavioral Health. For those of you that are familiar with the setup of the State Department of Human Services, you might know that OBH is actually under their umbrella, but they are, considered independent in a lot of ways. And this ASO program is being modeled after programs that are currently running in OBH. And there's a lot of protections to ensure that independence. I do think, this has been vetted through federal partners to make sure that that's going to meet muster, and it sounds like it will. So we're going forward with that. So as you start to hear about ASOs, that's related to this individual assessors, and that's where they're going to be housed. They're going to be available across the state. There's a lot of work being done right now to dial in using the CANs. There's some requests out there we have transitional funding in, most states have transitional funding to implement Families First. There's talk of using some of that funding, around this assessor and making sure that, we can work out the kinks and make sure it's working well. So as we hear about what programs are going to happen or how that's going to work, I'll keep you guys updated. But that's kind of where these ASOs are going to live. So the individual assessment is going to look at, a variety of things. And if if we're relying on this assessment, we want to make sure that it's being done the right way. So that's why these bullet points are here. These are the things that are going to show you this is a quality assessment that's done by the book and the way it's supposed to be. And the idea is that we want judicial partners, we want attorneys in the courtroom and everyone else to have a lot of faith in this tool and this assessment and to be able to rely on it. And so I think laying out what the requirements are will help us know this is an assessment I can rely on. This has been done, in the right way. And then that way we can really work together and feel good about following those recommendations. So obviously it has to be done by that qualified individual. We just talked about that. It has to appropriately consider a lot of child's specific information, including collateral information. You have to talk to the family, the child and the youth about their placement preferences. You really have to think about placement of siblings. The youth should be interviewed if appropriate. Obviously, we know that that's not always going to be the case, but getting their input is vital. Working with that family and permanency team is going to be really important. And then it will say whether the family agrees with the recommendation or not. And if the family doesn't agree with the recommendations, the assessment will lay out why they were not included. So there'll be some reasoning as to why that happened. So this assessment is going to, include quite a bit. And these assessors are going to have a pretty short period of time to put it together in. GALs will be part of that family and permanency team. So you'll be included in that work when it comes out. And that, I keep clicking on the wrong button. So it's trying to jump ahead of me. So this part of the bench card should help you just kind of think through that each time and make sure things are happening the way they should. Do I have a question on that one, Ms. Megan?
We've got a question and a comment. So just want to make sure, direct your attention over to the chat. Angelina has put in a link to a 10-minute video on the CANS tool, which was created by the Office of Behavioral Health. So that is a good resource to understand that tool. The question we have is really talking about incidences and situations where kids are being kept in hospital settings because they don't have placements. And so this person was wondering if there will be enough group placements under Families First that will have the space to accommodate children who need it.
So I don't have a crystal ball. I can't say for sure, but what I can tell you is that there is, I talked about some of that transitional funding. There are some proposals out asking for transitional funding to do some work around those types of issues, which would be, trying to figure out what the needs really are in Colorado. How many kids are in these settings that really don't belong there or there because there aren't other placements? How many kids are really critical and really need this, like those kids that have been hospitalized and things like that? And if they do need it, what are those needs? So Colorado's trying to dial in the needs so that they can then figure out the best way to meet those. So I don't know right now what that looks like, but I can tell you that is a concern that has been raised by a variety of groups. The State Department has been really responsive. There are some groups, offering solutions or at least ways to gather data to really inform decision-making around it. And then, as I mentioned before, they're talking about some different types of placement, like that new level of therapeutic foster care. There are some groups, they're really working hard on making sure we do have QRTPs available to us and that kind of thing. So the work is being done. The results, I can't tell you about yet, but I'm hopeful. All right. I'm going to move on to the next one, and then we can go from there. So findings are found throughout the bench card in a variety of places. Kind of what I consider your basic findings are on the front. Those have been added to 19.1.115. Obviously, there's other findings under 19.1.115 you'd have to make in addition to these for a youth that's in QRTP. But these are the basics. Is it the most effective, appropriate level of care in the least restrictive environment and consistent with the permanency plan? Those are all requirements from the federal Families First language that we've then incorporated into Colorado statute. But it's really not that easy, because if you think about it, we've also included a chart of findings because you have these various scenarios that you're going to encounter. So because you have the court and the independent assessor and those pieces having to work together, this plays out in this chart here. So if you'll notice, like the box on the top left is when your qualified assessment recommends QRTP and the court approves QRTP. So then that box is the findings that would be made. But if you move to the right of that box, if you have an assessment that recommends QRTP, but the court does not approve QRTP, then you're in the findings in that second box. And it goes vice versa on the bottom. So the bottom row is where the assessment does not recommend QRTP, and either the court approves it or the court doesn't approve it. So that's why this is laid out that way. I should also say this little bottom part, we're not going to talk about the Division of Youth Services yet. I took these pictures from the bench card itself, so I was being really consistent with what was on there. So I'm just going to scribble that out because we're not talking about that yet. So this is just a snapshot of the findings and what would be required in those 4 instances that could occur. If you're in one of these instances where the court is not doing what the assessment recommends, then there's going to be an additional set of findings that are required. So we have called that like deviation language is what we called it. And so you'll see that on the bench card as well. And that says basically the court should give great weight to this recommendation. And if they deviate from the recommendations, they have to make specific findings of fact to back that up. And those factors are set forth in 115 subsection 4H. So there are 4 of them. It talks about whether the protocol was followed. So that's, again, why we talked before about what's required of the assessment. If they're doing all those things, we should have a good assessment that we can rely on. We really don't. We're hoping that the court is not forced to deviate from these findings a lot because they're reliable, they're evidence-based, they're based on this tool. It's something that, should really help the process. But of course, we know there are times when the court will need to deviate. There are a variety of things we could think of. We've all seen the most crazy things ever. So I'm sure it's not hard for you to come up with those things. But for the most part, this should be reliable if they're following the assessment. If they didn't follow it, that's another situation, which is why that previous slide, I think, becomes important when you're prepping and thinking about these things. The strengths and specific treatment or service needs of the child, youth, or family, if they just disagree or because of their history with the family know something different, or because a guardian ad litem made a convincing record, or because a parent made a convincing record or something, they just need to cite the why. And then they have to make some other findings like expected length of stay and things like that. So there is a way for the court to deviate, obviously. But if they do, it should be thoughtful and intentional, and it should give some factors about why that's happening, which I think will help improve practice as we go along under this. Any other questions or any new questions about the findings and some of the stuff in this chart?
We've got a question that's come in that's a little bit more about the timeframes than it is about findings specifically. Do you want me to ask that now?
Why not?
Okay, let's this person is really wanting to know about a situation. What happens if a youth is placed in a QRTP from the start of the DNN? What happens to the timeframes required if that is, excuse me, let me just read this better. What happens if the youth is placed in a QRTP from the start of the DNN and the timeframes require the findings be made before the court has adopted a permanency plan?
Yeah, so you'll notice, I think, in the language here, and let me see if I don't know if I can undo that green box. I may not be able to, but it does say if a treatment plan has been adopted. So there is an if in there in case that hadn't happened. Or I'm sorry, permanency goal. So that certainly is possible. And we did, I thought, adjust the language to account for that. Again, this bench card is fairly new. So if people are using it, I mean, you're not going to be using it. That's not the right word. But as you're thinking about it and things like that, if you have questions or you see things that maybe aren't quite jiving for you, please reach out to me because, we definitely could have missed something or need to update something. But we did account for that situation. It was one of the changes we had to make as we went along because we realized that timing might happen. Okay, so I'm going to move on to the next one, and people can pop up with questions when they need to. So this is one of those areas where it's just super complicated. So juvenile delinquency and QRTP, like I said, in Colorado, I think we've talked about this before. Colorado is very different in the way we handle our juvenile justice population. It is not under the purview of the Department of Human Services in many other states. And these youth are 4E eligible, which means if they want to pull down 4E funding, then they need to comply with the requirements of Families First. In Colorado, the state embraced that. They wanted this to happen. The Division of Youth Services and some of the juvenile justice folks, talked about it and said, no, we want to opt in. We think this is better for youth. But obviously, this plays out a little differently when you're talking about a delinquency case. And so we can talk about that a little bit because this population is so unique and there are so many other issues or just nuances. I wouldn't say issues, I would say nuances. There has been a juvenile justice work group that was convened. It was not one of the original work groups of the implementation team. It started later. But it was to really work out some of the kinks and some of these things. And that group was involved in this bench card. So there are a few little pieces of the bench card I'll point out that were kind of specifically targeted towards using this in a delinquency court. The basic is that, an assessment, like we talked about, will be done for youth being placed in a QRTP or when stepping down in the QRTP if they're in the juvenile justice population. But it's important to note that this CANS tool we're talking about is just one of the approved tools and assessments for these youth, because I think those of you working in the juvenile justice field know massive juvenile justice reform was passed in the last year or two. And that particular reform bill requires a lot of other evidence-based assessment and tools. So you're going to have a variety of tools that are going to be used for these kids. There are membership in our group and the reform group that are both working on this to try to make sure that they work together as much as possible. Some of those other assessments have different purposes because, again, for these youth, in some cases, statutorily, they may be required to be detained or have other needs. Obviously, when a judge is sentencing a youth, that is outside of the purview of QRTP and some of these assessments. Commitment is different than a placement per se. And it becomes very confused because a youth could be committed and then they could step down into like a QRTP setting. And so do they need to do the assessment at that point or not? And I think that in general, they are going to use the CANS assessment. They're going to use that when it comes to decisions like stepping down and things like that. But this QRTP assessment can't tell them who should be detained or not detained, who should be committed or not committed. If there are statutory reasons and safety reasons why youth has to be committed, this process isn't overtaking that, if that makes sense. They are going to work together though. And this juvenile justice work group is going to be working through some guidance on how that plays out and what it looks like. And as that comes out, we will continue to do training on things like that as well. So I put this initial QRTP placement section up here. We've already talked about it, but you'll notice there was this little asterisk here. And the asterisk is really related to this juvenile justice work. So that asterisk takes you to this language in the bench card that talks about this initial hearing. Some of our youth involved in the juvenile justice world don't have an open active case. So if a youth has an open active case in court, then the court needs to be doing these approvals. But there needs to be a mechanism if the court is not involved to do these approvals. And in Colorado, that's going to be done by our Administrative Review Division, or ARD. So this division is already involved in doing a lot of this type of work. It is permitted under Families First to have another group do it if authorized in the prevention plan, or I think authorized by the court. So if the juvenile is committed to DYS and no longer under the jurisdiction of the court, then these QRTP reviews can be held as ARD reviews. The ARD division would make this initial hearing kind of findings and requirements. If you do have a court case, but the court, all of the parties consent to have ARD review this, it can be done in our ARD. The preference is to have this done in court when you have court though. This is supposed to be a court process. You're supposed to get court approval. We needed to have this flexibility because of the juvenile justice population. And frankly, because in some counties, ARD does some of these things because maybe courts don't meet as frequently. I'm thinking some of our rural jurisdictions, I believe, function that way. So we have the flexibility, but I will just tell you, and maybe this is my bias, I'll just be frank, I really feel like this needs to be happening in court as much as possible. So ideally in court, but if not, you do have this flexibility built in. I mentioned it before, but commitment is not placement. Like I said, there's other rules and statutes in play when it comes to commitment, and this CANS tool isn't going to overrule a judge in his sentencing or what DYS has to do as far as commitment. They have some of their own assessments for commitment levels and where they need to be, but they are going to use it when it comes to if they are going to be in a QRTP setting, using that CANS, trying to be consistent. Definitely looking at it when they're stepping down or coming out, or obviously our pre-commitment youth, this would be important for them as well. Families First, if you'll remember, also requires states to track whether implementation of Families First is increasing youth going into juvenile justice systems. So kind of back to the question we just had about these difficult youth and they're in hospitals and what are we going to have for a placement continuum? I think there was some concern that if you have these difficult to place youth and you don't have group homes and things like that to put them in, are they going to get committed more? Are they going to be put in detention more? Are they going to be just shoved into the juvenile justice system more? So there's a report that's going to be required by Families First that's not due until 2026. But Colorado is going to, get in front of this and really be thinking about this strategically from the beginning. So one thing that's going to help us track this is they, this year in that Senate bill, added some language in statute to sort of prompt this tracking or prompt this thinking. And that's this language here. So when you are committing a youth to the Division of Youth Services, the court has to make a specific determination about whether a lack of available and appropriate congregate care placements was a contributing factor to the commitment. So this will give us some data that can be relied on and pulled out later to really judge how this is affecting this population. Any questions? I'm sure there are questions. Any questions about juvenile delinquency stuff at this point?
We've got one on if a kid is committed to DOAS, generally DHS and GAL appointments are terminated. So at that point, who is left to attend an ARD?
So they still will have to have that family and permanency team. So they'll have members of their family, therapeutic members. If the youth's over 14, they'll get to pick members. They'll have the assessor who's doing it, who's pulled it together. So that family and permanency team will still exist. It may look differently. It may have probation officers on it. It may have case managers on it. So it may look differently, but there'll still be that team that has to be involved in it.
Thank you. And then this one's more of a general question that came up during this part. How does the review process work when DHS uses a voluntary placement agreement to place the youth in a QRTP without a court-involved case being filed?
So Angelina may have to jump in on this. I don't remember, I'm not sure that we can place a youth in QRTP without court oversight anymore once Families First is begun. If I'm wrong on that, Angelina, please pop up. But I believe that in order for a youth to be in a QRTP, you have to have court approval. That's part of the federal requirement. So I don't believe that you can voluntarily place a youth in QRTP once Families First has been instigated, although maybe there was a carve out for ARD to do that. I don't remember. Angelina, do you remember?
Yeah, I think that's part of the conversation that the ARD team is having, because if there is for some reason a voluntary placement agreement and it has been identified that a youth does sort of meet that level of care, we wouldn't want to, right? If that's a need, we wouldn't want to say, sorry, no, that's just not an option. So we would need to, they'd still have to go through the same process of doing the assessment and the CANs and having the family and permanency team meeting. I think that ARD group is sort of figuring out whether it would be appropriate for them to be the people who review.
So potentially they would also do the initial hearing and the approval of it.
Right.
Okay. So it sounds like that would happen through ARD and that's being worked out. Any other questions, Megan?
Just to follow up, just a clarification on the first question I asked when I said generally a GAL is dismissed if the kid is in DYS. A GAL could stay on if the parent is not competent. Is that correct?
So the only way a GAL can stay on for a youth that's committed and doesn't have any other open cases, first of all, we will pay for them to attend the first, like the initial, I forget what they call it at this point, the initial staffing for the youth within DYS, although whether or not they allow that or not has been an ongoing battle. The only way that they allow a GAL to stay on post-commitment is if there is also an open DNN case or a DNN case being held in abeyance.
Thank you, Ashley.
All right. So next section are those reviews. As I said, I kind of clipped this from the actual bench card. So we're going to get rid of this youth services part because we just talked about that. And we're not going to talk about this discharge part quite yet. We're just going to look at these reviews. So this is once they're in, it's been approved. We have the findings. We're doing these 90-day reviews. Again, it needs to happen at least every 90 days. So it clearly can happen more frequently. It can be combined with other hearings. I will go so far as to say it should be combined with other hearings. We're not trying to generate new work for you or new work for the courts. This needs to happen when you're going into court. But if you're not going into court at least every 90 days, you need to be once they're in QRTP, which I think makes sense if you think about it. These are difficult kids in difficult situations. We don't want them languishing in these QRTPs. So having more frequent court reviews when they're in QRTP, I think makes a lot of sense. It's probably consistent with what a lot of your courts are doing already, but this is just putting it out in relation to QRTP specifically. So where this comes from, these different bullet points, is that the federal law required the department to provide a list of things to the court at reviews, and that's what's incorporated here. It's interesting because in the federal language, it doesn't actually require the court to do anything with it, but I think we just assumed, or we thought, if the evidence has to be given, obviously the court needs to review those things. So that's the basis of where this laundry list came from. There has been a section added in 19-1-115 kind of detailing the evidence that's required at these hearings. So that's in subsection G. Again, that was added with this Families First legislation that came through. So you can look at that specific language. But generally, these are kind of the things that you're going to want to make sure the court has, or in your family services plan, has been laid out for these youth in QRTP. And these should be addressed every time you're in court and people are thinking about it. Some things I just wanted to highlight in here. Obviously, you always have to be keeping track of these timeframes, but from day one, they say discharge planning should begin. Even if you don't know when discharge is, you should be working towards what they're going to need to discharge, what they're going to need to be successful at home, and start that planning early on and not have to do it in a rush at the end when you're getting ready to move them. You have to continue to be consistent with the goals of the specific child and youth. And there are going to be these ongoing assessments of strengths and needs. Now, these ongoing assessments are done by the facility. So these aren't going to be like the CANS group coming in and continuing to do these. But there's this idea that as the youth is getting treatment and changing, or you're finding out more about them, or they're responding or not responding, that the treatment model is also responding, and that you're continuing to respond to their needs, and not just letting them kind of sit and languish or keep doing something that's not working for them and things of that nature. The stuff that you guys advocate for on a daily basis already is just kind of laid out in here, which is great. You have to continue making those findings that their needs can't be met in a family foster home, kinship home, or with parents. So again, you're always looking, can I get them in that, more appropriate level of care? And the idea is that we're using this for treatment, not placement and containment. So I think, we all know there are times when these types of placements are used for placement and containment, because again, going back to the comment of the person talking about our placement rate, we haven't had a lot of choices, and that's just simply not going to continue to be an option. So it's going to force, state departments, counties, communities to come up with, I think, creative solutions. And it might be a little painful as it happens, but I think in the end, it's going to result in a much better system. So these, again, specific treatment and services, specific efforts, like getting specific, talking about this kid, keeping the court updated, knowing how this is going is going to be really important. And the QRTP placement has to facilitate family and sibling participation and contact. Oh, see, I got all trigger happy over here. I was being very emphatic by pointing. You guys couldn't tell. So this is really important, I think, to us, is that even though these kids are in residential treatment, they really still need to have that family and sibling participation and contact. And it's family and sibling. It's not only if the families sing, then the siblings should. Siblings have their own right that's laid out in these Families First areas when appropriate. Obviously, we know in some of these kids' situations, they may not be able to see a sibling because of protection orders or other concerns, but it's really important to keep that at the forefront. And that not only are they having contact, but those family members are integrated into treatment. including siblings. And I think a lot of us probably have stories about how the relationship between siblings has been a big part of the issue for why a placement, why somebody could step down or couldn't step down, or what was going on. So I think it's really important. And I'm happy to see that in QRTP, they're taking that seriously, that it's whole family treatment as well as the individual needs of the kids. And then, of course, once they are ready to discharge, we talked about this before, but that discharge has this requirement of the 6-month family-based aftercare plan. So this plan is also something this QRTP work group has been working on in conjunction with our services continuum group. And there's a lot of things in the works right now about how this is going to happen. So it's the QRTP's responsibility to provide this. I think that they are often going to work in conjunction with Medicaid and the regional, I'm losing the acronym. There's so many acronyms. The regional centers that provide services, they're going to work with them about doing some aftercare. Obviously, I think there's going to be some partnership between QRTPs to maybe provide some of this aftercare. So there's going to be a variety of ways this is done, and talking now and planning for how that happens for youth, especially because we know, some of our rural youth are placed in QRTPs that are in Denver. It happens all the time. And so really thinking through how that's going to work and how they're going to get that aftercare plan. Because again, this is not a suggestion, this is a requirement. So there are a lot of people working on how this is going to work and making sure we have quite a few options to do it with. Okay, so let me think. I think that was everything I was going to cover in the reviews. To anybody, and that's the bench card. So let's talk about some of your other broader questions that we can answer at this point. And look, 3 minutes to spare. I wasn't going to keep you past your hour.
I'm really impressed with your timing, Ashley. We don't have any questions coming in, but we can hang tight to see if any others do come. It seems like from the questions that have been asked, this has prompted a lot of really interesting thoughts and generated some great questions. So I will let you know if others come in.
That's great. I really appreciate everyone being here for this. This Families First stuff, it's going to be big. It's going to be a change. There's so many unknowns. So I think getting a handle on what the court process looks like is going to help. Now that we have this, I think it will help us think about other parts of this and how it's going to work. I know a lot of people are really concerned about placements and what's available. I can just assure you that that is not a question that's being ignored. It's a big part of our work on the implementation team and some of these other work groups and some of the work the State Department is doing. So, I continue to be excited about what this means for our state. I think true change is difficult and needed, and it's going to be better. I don't know. I talked a little bit about the Tennyson Center doing things differently. If anybody gets a chance to read, there was a article in, I think, Business News or something like that about the feds are making me change my business model, and I'm glad. And Ned Breslin wrote it. And it does kind of encompass some of that these changes are hard and they're going to be better for families. And so we just got to get through the difficult part so that we can do a better job around the state. And there's a lot of really good people working on it, which is pretty exciting. And again, I'm always open to any of your questions or comments, or if you just want to talk about Families First with me. I spend so much of my life doing it right now. I'm happy to talk about it. And we at the OCR will really continue to support you in understanding what's happening around the state, keeping you updated, providing training when we get different options, and we'll just keep going until we see implementation happen. So I really appreciate everyone being here today.
One question did come in, Ashley. Thank you for saying all of those things. I know you don't have a crystal ball, but how do you think all of this will affect facilities like ROP, Southern Peaks, and Third Way?
So I think that I'm going to do this so I could I don't know if I could see other people's faces or not. I do think that we are going to end up with some providers that really concentrate on smaller, high quality therapeutic services, and that is going to be much better for kids that need that high level of care. There are some of our big RCCFs, like I said, Tennyson, who are embracing it. And there are some of the big RCCFs that I think are having a hard time deciding how this is going to work. So the State Department of Human Services has some work cut out for them to ensure that it is a sustainable business model to do this sort of small, high quality treatment facility. And from all my conversations with them, they're dedicated to doing that because they understand that. I think, you know, some of the third ways and things like that are trying to figure out, you know, like Third Way is a good example. They have all these different facilities and different pods. And so I think they're kind of trying to figure out, you know, they don't think it's fair that the whole umbrella is considered, you know, the 16 beds, that their different facilities aren't. I think what they're going to do is they're going to adapt some facilities to meet the needs of some of these. This is me just talking, guys. This is not like official policy, but if you just want my thoughts, these are my thoughts. So I think that they'll adapt some of these smaller facilities to meet the needs of some of these carve out groups, like they do already, like independent living or the pregnant and parenting teens or things like that. So I think you'll have some people that embrace that also do the QRTP, that maybe have a branch that start doing these really intensive in-home services and providing some of these other services to kind of fill the gap. I think some counties may pay for placements that aren't supported by 4E because they feel like they don't have a choice. I think that might happen. When it comes to ROP and some of those, that's a little more complicated because it doesn't, Families First doesn't completely change the detention side of things and the DYS side of things. So I think you'll see some changes to the trauma-informed care model and to some of the staffing, like they're going to, you know, and things like that. You will see some more intentional stepping down of kids and into the right levels of care. But I think those facilities that do both, the changes might be a little harder to see at first, would be my guess. I don't know, Angelina, am I saying anything that's making you roll your eyes or go like, oh my God, I can't believe you said that?
No, I mean, I think I would just add, like, what's really important to remember is the state is creating work groups so that we can have providers and counties and stakeholders involved in the process of figuring out, like, what's the best way for facilities to transition or for providers to transition to this new model. And as with all change management, right, people are uncomfortable and they don't like it, and yet we still have to do it. So, you know, and I just want to highlight also that this isn't a Colorado specific thing, right? The issue with IMD, it's nationwide. A lot of states, I don't want to say a lot, some states addressed this years ago. And so they're not having the same issue. And Colorado just, you know, we never got dinged by CMS, which is the Medicaid agency at the federal level. So because of that, we've managed to sort of skirt around it for a while, and now they've come for us. So it's time for us to figure it out. And so the state is really trying to encourage the right conversations and creating space for those conversations to happen. But we can't force anybody to do anything. And so if businesses decide that they don't agree and they're not going to change their model, then that's what they decide. And counties will have to figure out, like Ashley said, if they want to continue to pay for those placements out of their own budgets, or if they want to say, okay, you didn't change and we, you know, believe in the philosophy of family first, is sort of where I come from in that. I think the transition to these new placement types really does fall very much in line with the philosophy of the entire legislation. And of course, the whole idea that there's going to be this whole new set of prevention services, right? So hopefully we're not having as many kids go into the system as we are currently, because we're able to provide them and their families prevention. So
the nice thing is, I mean, we've seen that play out. That's not just lip service. In Colorado, when we opted into the waiver program, our congregate care numbers, I don't know if people have tracked that, over the last 5 or 10 years has gone down significantly. So it is working. It just takes time. And I will tell you, there will be some RCCFs who will say, I'm not doing it. I will just give up Medicaid funding. I'm keeping my big bed numbers, and we're just going to deal with it. So we're going to see a wide variety. But I do think in the end, we're going to see some higher quality options that'll be really good for kids. So change is uncomfortable, but we're dedicated to it. So we'll see what happens in the end. All right. Well, if you have other questions, you guys know how to reach me and find me. Please email me. Like I said, this is going to be a series. We're going to do this with other professionals as we go through. If there's other areas we need to come back to, I'll circle back to you all. And then as more things come out of our implementation team, we will craft more training around it and keep you updated and on the cutting edge. Thanks so much, everybody.